You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vet Rehabbers! Today I share with you one of the trainings we have in our members business basics area. Your success in your practice is important to us, and so we've created a section in the members area to support you with running a successful, profitable vet rehab practice. In this training, Lisa Mason shares with us how we can use adjunct therapies and modalities to increase our revenue and to save time. She speaks about different modalities including underwater treadmill, PEMF, laser therapy, shockwave, ultrasound, and electrical stimulation. She discusses some of the different questions and concerns we might have. So things like, can I afford it? Will I actually use this equipment? Do I have the staff? Do I need to train the staff? Do I have the space? Before we head over to the training, first a word from our sponsors. Choosing the right therapy, laser, and PEMF systems for your practice are big decisions, and that's why Response System has been helping to make that decision easier for over 35 years by offering Class 3B and Class 4 lasers, as well as a full line of PEMF products designed for both small animals and horses. All of their systems are fully rechargeable and adapted for international grids. You can find out more at responsesystems.com. You can also come and chat to Response System at the Vet Rehab Summit. This is our annual online veterinary rehabilitation conference. It's on the 13th of November this year. Our online pet health members get free VIP access. You can find out more at vetrehabsummit.com. So if you're interested in more business help and support, why not join our Business Vet Rehabbers Facebook group? And also members, you can access more of the business training in our business basics area on the members portal. And non-members, we have some help also in the free zone. You can sign up at www.onlinepethealth.com/free. So over to the training with Lisa. Hey Vet Rehabbers, thanks again to Lisa Mason. Hi Lisa, thanks for joining us.
Hi Megan.
Lisa's going to be chatting about how to use adjunct therapies to boost revenue.
Thanks, Megan. So I'm Lisa Mason, a veterinarian in Central Florida. I'm the owner and sole veterinarian of Florida Veterinary Rehabilitation. I am a veterinarian and a rehab therapist and veterinary acupuncturist. We've been open for about 2 years now and have been very successful as a standalone rehabilitation facility. And today we want to talk about how to use adjunct therapies to boost your revenue. So we all know that rehabilitation is awesome and it works, but sometimes we work as sole practitioners. We are sometimes just ourselves using our hands. We don't have any special magical tools. We don't have the fancy rehabilitation equipment like the treadmill or laser. And some of us may be asking, how can we make our revenue stronger by adding some of these tools? And it can be daunting when you go into this. You can start asking yourself, how am I going to afford it, and things like that. So we want to talk about how we can actually add in these tools to boost the revenue, while we're also actually increasing the number of pets that we're seeing. We're improving our results by using these technologies as well, by adding these adjunct therapies. So what are adjunct therapies? These are the fancy show-off underwater treadmill, the fancy new laser, the dogs that get to wear the goggles that make the great pictures, but they're also adjunct therapies that can boost your revenue as well. The financial commitment to purchase this new equipment is very scary to jump into. And we're going to dive into all of the different ways that we need to look at this before making that financial commitment. So we may find ourselves worrying, how much staff is it going to require me to have? I work by myself right now. I'm a mobile practice, or I want to get into standalone rehab facility. I have no business knowledge. What do I do? How do I add staff? How much is this going to cost me? How much space am I going to need? What about the upkeep for the long term? So let's dive into all of these concerns on how you can set up adjunct therapies to boost your revenues. So first we're going to say, can I afford it? So when we're looking at this, we want to make sure that you've got your bottom line covered. And then we're going to look at all the different costs that go behind one piece of equipment, whether it's the additional staff or the additional space that we need. Will I actually use it? Is this a product that I feel strongly about? I may say, well, everybody else has an ultrasound. Should I buy an ultrasound? I don't really know how to use it very well. I've heard how to use it and I learned how to use it, but I don't think I'm going to really use it. Do I have the additional staff to be able to care for the product, to be able to use the product? Do I have to train more staff? Do I need to hire somebody that's got higher certifications? Do I have the space to build out for this equipment? So let's start off by talking about, can I afford it? So this is, we need to sit down and analyze the return on the investment. We're going to look at what the initial cost is. Now, let's say you decide that you want an underwater treadmill and they're giving you a brand new deal that you can do 12 months, no interest, no payments for a whole year. That means you get to basically prepay for the instrument. That's pretty exciting, but let's look, that's very exciting. So we want to get that lowest interest rate, which is free in this case, but can we pay it off after a year? What is going to be our ongoing cost for upkeep? Do I need to pay for a warranty? Do I have a short warranty? Is the warranty going to last for longer than that? These are important things that we've got to ask ourselves, and also ask the person who you're buying it from, because this is something that they'll be able to share with you is, you know, potentially after 3 years of a free warranty, at year 5 or at year 4, I have to buy another 3-year warranty that's $5,000. Well, that's an extra added expense that we need to plan for. How many treatments per day or week or year do I need to sell to pay this off? Meaning, is this even feasible? So if I need to pay off that treadmill within 1 year, I need to make sure that I'm selling at least 7 treadmills 5 days a week for every week in the year to be able to pay this off. I don't know if I can do that. But I may absolutely say, yes, that's absolutely something that I can do. What is the staff that I need to run it? Am I running it, or is a technician running it, or can an assistant run it? So in this case, your time is very important. So if you are having to run this new piece of equipment, that's going to take time away from your rehabilitation reassessments, your initial evaluations. So we need to encourage you to buy a piece of equipment that's going to have a technician or an assistant be able to run it to really make the most bang for your buck. So in this case, an underwater treadmill, I absolutely can hire a technician or assistant to be able to run this. And how much time do these people need for a session? Is this going to be something that I need to hire someone that's very efficient, such as a trained staff member that is trained in underwater treadmill? They're going to be more efficient to run this a little faster. They're going to be able to get the dogs in and out of the treadmill faster. That's going to be a very important question to ask. The space or setup needed. So when I had to bring in my underwater treadmill, we had to expand out quite a bit, and it cost a lot of money because we had to change the space, and we had to add in a water hose. We had to add in a drain. So those are things that you need to consider when you're bringing in new equipment. Is this something that I can afford to do? Now, after all of that said and done, how much do I actually charge for the session? And I think this is where it's important for you to look at what everybody else is charging, first of all. If you have competition, then finding out what your competition is charging is important. Also around the world and around, you know, your country, how much is being charged, so that you kind of fit somewhere within there. But on top of that, you need to also look at how much it's actually costing you and try and be able to cover that cost by charging the appropriate amount. So will you use it? This is absolutely the most important, in my opinion, because if you can't buy something that's going to be sitting collecting dust. And so we want to look at what is going to convince you to use it. And I think research is the most important. Looking through the research, saying, are there studies that can support my use? Do I know what conditions I'm going to use it in? Also calling other practitioners that have that piece of equipment. For instance, if you want to buy a piezo wave shockwave, I would call up everyone who may have a shockwave and say, do you love it? Do you use it all the time? Is this an important piece of equipment that I should purchase? And then we also want to understand when and how to use it. Do I use the laser or do I use the shockwave, or do I use both? Do I pull out an ultrasound? How about acupuncture? When do I use each one of these modalities? And I think that's a very personal question, because I think you need to be able to understand how you yourself are going to best manage that piece of equipment and what your knowledge is and your comfort level with it is. Jumping into staff. Do I need to hire more staff? This is very time consuming. It can be daunting, especially if you personally don't have a lot of business or management skills. This is where you need to either hire someone that can help you as a business person, or be able to walk through different staff members' resumes to look at who's going to be the right fit. You also need to know, are you going to hire someone with pre-training that went to a program and is certified, or are you going to train them yourself? Because that's going to be where your money is going to also fall. If you hire somebody that is less experienced and you can train them yourself, you can probably pay them lower to start off with, and so it'll be a lower expense for you. Also, does the equipment require further certification or training? With lasers, you know, you can train them in-house with the folks who own the equipment or who sell the equipment. They can help certify and train. With an underwater treadmill, I wouldn't just throw any Joe into the treadmill and say, go on with it. I would like somebody that's going to be certified. So I'm going to inherently charge or spend more money per hour running my treadmill than I would running my laser, because I do want someone to have excelled knowledge and certification about it. And again, how much does that staff member need to be paid to use the equipment? So it could be a lower amount or a higher amount. And then how much time does a well-trained staff member need to use the equipment? And I bring this up because a well-trained staff member who may be paying more might be able to do the actual activity or therapy in a smaller period of time than a poorly trained staff member or than a lesser knowledgeable staff member. So it may actually be worth your money to hire the person who is better trained, so that you actually may not need to spend as much time helping. And then also you need to look at your legalities. Look at, can the person use this equipment without direct supervision? And that's going to be personal state or country laws that you need to look at. So for instance, in the state of Florida, technicians cannot put acupuncture needles in. So if the acupuncture needle falls out, they can't put it back in, but they can remove the acupuncture needles. So that's just a small little legality that we need to make sure that we're knowledgeable about. Do you have adequate space? Do you need to build out the space? So as you can see, this is my underwater treadmill room. And in this space, we had to build on. And like I said before, this was quite a bit of an expense. It was worth it in the long run. But if you are brand new in this, that might be a very scary task to try and build onto a building to add into a treadmill room. And I do think that if you decide to dive into, say, an underwater treadmill, working with the treadmill company's engineers to help you to make sure that that space is adequate, I think is very important. Now, how will it be maneuvered? So for instance, the treadmill is not going to be moved. So you know that wherever you place it, it's going to stay. But let's say you have a laser that's too heavy to carry and you need to maneuver up and down stairs. That's not going to work for you. So you need to make sure you take one that's a little lighter. Let's say you have a travel vet clinic and you get a laser that is too heavy to roll around, or a shockwave that may be too heavy to roll around or to move around. That's not going to be something you're going to pull out and use as frequently. But make sure that you are understanding, do I need to buy a cart? Is that going to be an added expense? And then also, can you still work on your other appointments around this equipment? So you don't want to put an underwater treadmill in your land exercise room where you're going to be doing therapies, because maybe the treadmill is going to take up the room that you formerly used for your cavalettis. The treadmill does require a great deal of space, and so we need to make sure we're planning that out and that we're not affecting other areas that we are already currently using. And then what other special needs will this equipment have? So this is going to be, for instance, the treadmill, the water quality. That's a lot of time that can be put into that, making sure that the water quality is perfect, making sure that the tank is cleaned out, that the filters are cleaned out regularly, that you're making sure that the water stays bacteria free. And that may take a knowledgeable staff member for that. It may take them extra time during the week to be able to work on. And so thinking about these things ahead of the time is very important. So let's use an investment example here. So let's say you want to buy a laser. It's $35,000 US dollars. You're going to get that loan, that 12 months, no interest, no payments. The warranty is going to be free or included for 5 years. That means anything breaks, they cover it. You can hire a technician for, say, $11 an hour, and there's no special setup needed for the rooms. Maybe you just need a 3-prong outlet or an appropriate electrical outlet. You might be able to put it in the schedule, using it 15 to 45 minutes several times a day. Your charge to the client may be $45 to $75 per session, and you'll be able to pay this off by only selling 1 to 3 treatments per day for the year, and your equipment's going to be completely paid off. Well, that's a pretty smart investment. So when we sit down and actually lay all of those items out, we can decide, is this piece of equipment going to be smart for us to purchase or not to use as an adjunct therapy? Now we have to make sure you're going to use it. So you want to know and believe that it works. And that's going to be, again, you've got to be able to look at the research, call your pals, ask them if it works. If you don't believe in it, you're not going to sell it. Use it on your own pets and your staff's pets. Get their knowledge about it. Make sure you're seeing the improvements that you expect to see. And in some of these equipment cases, you may actually be able to borrow the equipment for a few weeks and try it out on everybody, try it on a couple of clients or a couple of the patients. See if this is working for you. If it doesn't work for you, then I think it's the wrong choice for you and you're not going to use it. And make sure you're continuing to gather that knowledge and examples to share with the clients. Share your success stories with these therapies. In the treatment plans, we want to make sure that we're including them both in the short term as well as in our maintenance plans. So, for example, with the laser, you may start off with 2 to 3 times weekly for the first 2 weeks, and then continue once monthly to maintain the pet's discomfort or comfort level. I've seen very often coming from primary care vets who may have a laser in their clinic that they may have treated the pets during a laser package that they sold to the clients. And then the clients say, yes, the laser worked while they were using it, but they never told us that we were supposed to follow up with it. And so I think it's important both for regular rehabilitation veterinarians and primary care vets that we're going to be able to come up with a long-term plan to maintain comfort. A lot of the diseases that we deal with are chronic diseases, and they're not just fixed within a short-term treatment plan. So we need to include long-term plans, and that way you're going to continue to use these adjunct therapies. And I think that's an important goal for us to have, is to be able to maintain comfort and to continue to use these. So in order to evaluate did I make the right choice? Did I make the right purchase? We're going to check your financials. Is the product being sold appropriately to pay off in a reasonable time? If it's not, then re-examine your comfort level with the actual results of the product. So if you bought a laser and you're using it a couple of times, or maybe you've used it once or twice on a couple of patients and you're not real happy with the results, I think it's important that you re-examine how comfortable you are with that laser and the protocols in that laser. Check in with the tech. Is the product functioning well? Well, we had a new laser come in and the software kept having glitches in the system, and it was challenging for the technician. It was challenging for the pet because they had to keep starting and stopping. And so I needed to make sure the technician was communicating with me so that we could then alter how that product was being used. We want to make sure that the technician is having a decent time with being able to use it. If they're struggling to properly treat the pets, then we're not going to get the results we want. So they may need you to add in an additional assistant to help them. Again, that's another cost, but we may need to add an assistant to help them hold the patients quiet. We may need to add an assistant to help them to keep the patient a little cooler during the exam or during the laser. Maybe even getting an assistant to help getting the patients in and out of the underwater treadmill so that the technician would be able to go a little faster and be able to treat more patients. We also want to look at, is there new research on the product to improve the product? So for instance, the laser protocols have recently changed with new research on osteoarthritis and degenerative myelopathy. If your laser doesn't have those protocols listed in them, then I think it's important that we make sure that we're either double dosing or we're calling the company and we're saying, hey, what about this new, these new guidelines? Can we alter the laser protocols? And if you're staying up on that, on your product that you have, you're going to be able to utilize it to its fullest potential and getting the most bang for your buck. So the bottom line here is going to be prescribe the therapies that work, that you believe in, that you've seen the experience that work. Utilize your staff to perform the therapies. During all of those conversations we had, none of those pieces of equipment were performed by doctors. The underwater treadmills used by a staff member, the lasers performed by an assistant. So making sure that we're utilizing all of our staff and we're training them well to perform these therapies is going to help boost your revenue by keeping your time free to be able to see more patients, because your time is money and we want to prioritize your time. Are there any questions?
Yeah. Thanks, Lisa. That was really, really thorough. I just got one major question that I want to chat to you about. And I think it's a question that comes up a lot with the vet rehabbers, is that when they buy equipment, do you recommend that they charge individually? So, you know, there are two ways in which you can charge. You can either have like a consultation fee that includes everything. So it doesn't matter what you do. So if you do therapeutic exercise, if you do laser, if you do PEMF, then you just have one fee that you can then quote the owner. Or do you recommend that you charge a consultation fee and then add extra depending on the modality? Because chatting now or listening now to what you're saying, it looks like you prefer charging individually, because then you can really work out whether a specific modality, if you buy a new piece of equipment, is going to be valuable. Because I'm thinking if you're charging one amount, what's the reason then to buy a laser? You know, yeah, you'd get better outcomes, but how are you going to generate more income from that specific piece of equipment?
Correct. Yeah, and I'm absolutely of the mindset that very specific, individualized treatments are necessary for each patient and condition. So I actually develop a whole treatment plan for each patient that includes an itemized bill of these. We're going to do treadmill, we're going to do laser, we're going to do acupuncture, and I lay it out that way. I think that if I said, I'm going to 1 hour of any therapy is going to be $200, let's say. I may be I may be cheating someone out when I could get by with just treating them with a 30-minute treadmill, say, for less money, whereas I may be not getting as much money for the case that needs to be there for treadmill, laser, acupuncture, chiropractic. It's one of those things. To me, I do much better if I offer the individualized plans that consist of what that specific patient needs to get better. And then I charge for it that way, which has always worked for me. It may work for some other people in other ways. Now, when we're utilizing staff, I think it's easier if you have it individualized. I think if you have a blanket, here's what they're going to do, but every treatment session may be a little different, that requires the vet or the rehab professional to be more involved each visit that they come in. So I think you're less able to use the adjunct therapies to continue to boost your revenue, because you have to still play an active role every visit that patient comes in. I'm not saying it's the wrong way. It's just whenever you're trying to look at boosting a revenue in a business, the best way is to have the rehab vet create that plan during the initial visit, and then your staff members are carrying out your plan and carrying out your treatments before you do your reevaluation.
Yeah, because you can really look at then, your individual staff members as people that are generating income for your practice. Because if you don't itemize each different modality or what they're doing, then it's very difficult to see who are the people in the practice who are actually paying for their worth being there, if you know what I mean.
Yeah, that's exactly it. And, I have a lot of clients that they ask, oh, what are we getting today? And we've gone through each modality, and it may be different every day. And I'm able to sit there and look at a patient and say, this is what I think is going to help them. Again, that comes back to being more of an expert in your field and kind of having an idea of what's going to help certain conditions. And at first that may be more difficult to do, but I'm able to sit there and say, today we're going to do laser, because we do laser every visit, but we may do treadmill one day, we may do land exercises another day. So I'm going to be able to, let the clients know that each day may be a little different, but they're going to be treated well, and they're going to have a staff member with them that's very knowledgeable about what they're doing. So I have one technician, all she does is laser, and she sits with my acupuncture patients, and she's awesome at it. I have one person, all they do is treadmill, and they're awesome at it. And one person is great with land exercise. So those people are going to be excel in that one thing that they do, and they maintain that treadmill, they maintain the land exercise, they maintain the laser better than anybody else probably can. So I've got it down to where that staff member has, basically taken ownership of that piece of equipment, and they know how best to treat the patient during it.
Yeah, so I think the last question I have is one of the things that are probably going through the vet rehab's mind is, when you do that, what happens when that staff member phones in sick?
Yeah.
What do you do then?
Yeah, that's a great question. So I used to basically freak out and have to cover it myself. But no, now I have a business or a hospital administrator, and she knows every position, every role in the clinic. And she's trained in every role in the clinic so that she can jump in when that staff member calls out. So I think it's very important to make sure you have somebody that can oversee, cover, and be the extra person. But if I have a small staff, I have 6 people in my staff. So if one person calls out, we feel it. We feel the short staff nature, but having that person that can oversee everything and be good at everything is also a very important person to have on your staff.
Yeah. I think also we just need to be realistic, is that the profession that we're in, we're doing things and treating things right now. And so like when we have any staff member that's not there, it is going to impact on us. And there's no way we can get around it besides other people filling in. It's very different to somebody who works in an office where the work that they're doing could be done the next day. So when they're sick, it doesn't always impact on everyone else. But in the veterinary world, in the vet rehab world, when someone's sick, it's going to impact on us. I mean, it's just how we handle it and how we have the systems in place so that it doesn't stress us out.
Yeah, and that's exactly it. And I will tell you, during COVID, it's been even more challenging because you've got, we're still on curbside service, and we've got the ins and the outs of the building, and we've got if somebody starts showing signs of problems of COVID, we have to shut down. Like it ends up being a real challenge because we work in close quarters. If somebody gets sick, everybody gets sick. So it's been extra challenging. And that comes down to where you just have to, breathe and let the clients know, hey, this is what's going on. We're just going to postpone your treatments for a day or two and get everything back together. And most people are very understanding.
Lisa, thank you so much. That was awesome training. And I think it'll be so valuable to the vet rehabbers.
Thanks, Megan.
Bye. Cheers. If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. For more information about continuing education for vet rehab therapists, you can go to onlinepethealth.com. I'd like to thank you for listening to this podcast, and of course, thank our sponsors, Response System. They are as passionate about therapy lasers and PEMF equipment as you are about veterinary rehabilitation. They would love to answer any questions you have, so please feel free to reach out to them at responsesystems.com, or you can email lisa@responsesystems.com.